Hello, this station will be about transference reaction for someone who was commenced on treatment and he doesn't want to continue receiving it. There are three main things to be done in the station. First thing is to elicit that the reason behind refusal of the patient to receive his psychiatric treatment anymore is the presence of transference reaction with someone of his medical team. The second thing is to explain this to the patient. And the third and last thing is to inform the patient about the management of this transference reaction. And with depending on open-ended questions at the beginning, this can help you to elicit the transference reaction. As we all know that transference reaction is the reaction that happens as a defense mechanism on facing difficult things the patient cannot deal with in reality. Start to ask the patient, "Hello, Mr. John, may I ask you if you are aware about the diagnosis of your condition?" He will start to tell you that he is suffering from schizophrenia, and then you can come to ask about specific issues that can lead someone to stop taking his medicine. We all know that there are general and common causes that can interfere with the compliance of any patient with his treatment. One of them is to find that the medications are not effective at all and that they didn't work at all. So if you ask the patient if he gained any benefit from using olanzapine, you will find that he is experiencing partial improvement on it. So that the medication didn't work will not be the cause. Then you can ask him that if he is experiencing any side effects of it. And you will find that there is no distressing or bothering side effects that are preventing him from continuing receiving his treatment. And then you can ask him if he is experiencing full recovery, because sometimes patients who are fully recovered from their illness can think to stop medication, even if the treating doctors informed them that they need to take it for maintenance phase of treatment. And by asking him if he is fully recovered from his illness, you will find that this is not true. And also, one possibility that can prevent someone from continuing receiving his treatment is coming across any information on the internet or reading something horrible or worrying about the treatment. And you can ask him, "I wonder, Mark, if you came across any information that made you worried about olanzapine," and you will find also this is not the case. And at that point, you need to make a conclusion and to think out loud to tell him, "Thank you, Mark, for sharing all this important information to me. And from what you have told me, it's clear that there is nothing related to treatment you are taking that is leading you to stop taking it. Now I'd like to ask you about something different. How would you describe your treating team to me?" And here, in this way, you are not asking about specific person, for example, his psychiatrist. It could be with the social worker, with the community psychiatric nurse, with the psychotherapist, if he is receiving psychotherapy, or with the occupational therapist. So you are not aware about the detailed structure of his treating team, and also you are not aware about who is the personnel that the patient is facing difficulties while communicating with him. So try to be open-minded while asking about this issue. And then he will describe the treating team to you. You can ask, "Do you find any difficulties while dealing with any member of your treating team?" This will be sufficient to elicit difficulties. And once he mentioned any difficulty with anyone of the treating team, here you need to ask him if this is the first time for him to experience these feelings. And here you reached the eliciting of transference, and you need to explain it to him. And after explaining what is meant by transference, you can tell him, "I have something important to add. If you are interested to know." Definitely he will tell you, "Yes, please, doctor." You can tell him, "Although I'm sorry to know that you are facing such difficulties while dealing with that staff member, but on the other hand, this is a good chance to know something about yourself and your way of dealing with difficulties. And by discussing that with your therapist, this will help you to replace this defense mechanism with a more adaptive way of dealing with difficulties in reality." and this can help you in your future relationships. And like transference for the patient who is receiving psychotherapy sessions, you need to inform the patient that he needs to discuss that with his therapist, but there are still some more steps that could be taken if the first step failed to help him. I mean to tell him that you will be beside him till managing this problem competently. And thank you.